Whether you want them to occur or not, ethical dilemmas are bound to show up at your workplace. But with a little bit of knowledge on the subject, they can seem less intimidating. So today we're going to be discussing these ethical dilemmas and why they arise and how to conquer them. And this will all be based around medical diagnostic sonography. So what exactly are ethical dilemmas? By definition, ethical dilemma is an issue that arises when two or more principles differ from one another. So examples, if a person gets hired and you know that there was another person who was much more suited for that position, but you come to find out that the person who did the hiring knows them personally, which is probably why they got hired. So that's somewhat of a dilemma. Using visual images to conceal the truth, and this happens a lot in prescription medication advertisements. They, by law, have to list the side effects of their medications, but they display photos or videos of happy people living a happy life, and that just kind of overlays the bad effects of the drug itself. And even depriving a colleague of important information, of course, that's a dilemma because that can bring up so many more issues. So what can you do? You can be prepared. You have to know that they are bound to happen at some point. They show up in any job. They can be between coworkers, management, patients or customers, and even with yourself. One thing that does help you become prepared is job shadowing. Job shadowing, the job that you want, allows you to potentially see what ethical dilemmas will arise in that position. So why do they arise? Because we are human. We all have our own thoughts and opinions, and these are instilled in us from a young age, whether it be our parents, grandparents, friends. We all have different opinions. And like Orange said in 1985, each sonographer must consider the ethical issues involved in the examination, know his or her feelings, and deal with them in order to avoid expressing those feelings during the examination. So a lack of communication or dishonest communication also leads to dilemmas. And false information definitely leads to it. So in the career of sonography, some dilemmas arise between the sonographer and the patient because so many patients self-diagnose themselves before they even have a scan, and they're dead set on what's wrong with them. They know already, and that definitely brings up some issues, especially because the sonographer can't disclose the diagnosis. They can't diagnose the patient, and a lot of the times the patient requests or demands an answer right then, and they can't do that. They also arise between the sonographer and the doctor or the radiologist, because you might have different opinions on what a scan shows, or a report doesn't have accurate information. That's being questioned. So how do you combat these ethical dilemmas? Lannon says it requires critical thinking, and of course. So how can I know the right action in this situation? What are my obligations and to whom in this situation? What values or ideas do I want to represent in this situation? And what is likely to happen if I do this or do that? And another thing that helps is kind of making a chart of a decision-making process. So you would define and analyze the problem at hand, or the dilemma. You would come up with some alternative solutions. Then you would evaluate these solutions, so weigh out the pros and cons of each one. and then you'd select the best solution, implement that decision, and then follow up. Another way to combat ethical dilemmas is by building strong teamwork. Teamwork is successful only when there is strong cooperation and trust, a recognized team structure, and clear communication. Proper communication between the diagnostic medical sonographer and the doctor will allow for a more successful rate of a diagnosis without any dilemmas. It also allows for other opinions in the matter, which is always helpful. Because even if you have two people, if you're both on the fence about something, it's always nice to have more people in that team effort. But in order for teamwork to work, communication has to be constant. Everybody has to be kept in the loop all the time. And reports. Reports can help with dilemmas because they offer a pretty clear and concise information. So like in sonography, these reports are typically analytical. They involve evaluating the information, interpreting it accurately, and drawing valid conclusions. So, you write down the symptoms, and then that gets sent to the doctor, and the doctor diagnoses them. Some codes of ethics for diagnostic medical sonography from the SDMS are to promote patient well-being, the following must be applied. So discuss with the patient the purpose of the procedure and to answer any questions that he or she may have. You must respect the patient's autonomy and their right to refuse the procedure. Non-judgment. Promote the privacy, dignity, and comfort of the patient while also maintaining HIPAA patient privacy regulations. And you must provide safety for the patient during the procedure. Ethic terms that really come into play with ethical dilemmas in sonography would be beneficence, which is the duty to do good and promote the best outcome for the patient. Non-maleficence, which simply just means above all, do no harm. And autonomy, which is the patient's right to make fully uniform decisions for themselves regarding their health or well-being. So in conclusion, the first step to dealing with an ethical dilemma is knowing that they are going to happen and just being prepared for that. Also having a strong teamwork or strong team helps with them because you get more opinions, and it just allows for a clearer workplace. But by asking yourself basic questions about dilemmas, and providing the accurate information using reports and relying on teamwork, these dilemmas can hopefully be settled with ease. Thank you.